This week's topic is the ethics of advocacy in nursing. This is just, I'm not going to read it. It's a definition of nurse advocacy, and it talks about how I think we all learn that we're patient advocates, but nurse advocacy goes beyond that, excuse me. Nurse advocacy encompasses defending the rights, needs, and interests of not only patients, but their families, communities, and our profession and healthcare as a whole. And we speak up for those who can't speak for themselves. We fight for equity. We fight for a healthcare system that can meet the needs of all in our country. The role of ethics in patient care and advocacy. Number one is our respect for autonomy. We know that patients have the right to make their own decisions. We or physicians do not make decisions for them. Beneficence, that means we always act in the best interest of patients and of the profession and of healthcare as a whole. Non-malfeasance means that we always seek to do no harm. Justice is we always advocate for fair and equitable treatment for all. And veracity talks about our duty to be honest and truthful in our interactions. In the first week, we talked about the ANA Code of Ethics, and those provisions are listed on the PowerPoint here. The provisions that are most closely related to advocacy are 1, 2, 3, 5, and 6, with the key provision 3. And in provision 3, we discuss advocacy, informed consent, confidentiality, respect for the dignity of all, safety and well-being, being culturally sensitive, and end-of-life care. Those are all addressed there. And those encompass a huge piece of, especially when direct patient care, of how we advocate for our patients. We make sure that they are treated with respect, that their views are held above their families, that we hold what they say confidentially. We do not make decisions for them, and we make sure when they make decisions that they have all the information that they need to make that decision, that they are always treated with dignity, and that we take their cultural and beliefs, values, etc. into consideration, and we support their right to make end-of-life decisions. And that includes advanced directives and preferences for palliative and hospice care. And we want to make sure their wishes are honored and that we provide compassionate support to patients and families. And this can be difficult if you have practiced, if you've been in an end-of-life situation with, which I like to call the daughter from California, where there's a plan in place, the patient has expressed what they want, the family is following, and then somebody from out of town comes and decides, no, we have to do everything possible, and they just crap all over the plan of care, and they're only thinking about themselves and their need to feel like they're doing something to try to help the person. And often it is from a place that is not trying to harm the patient, but they're only thinking of their own needs and their own guilt or whatever in the situation. And we are the ones that need to advocate to make sure that the patient's wants are followed. And that can be difficult because sometimes there is a disconnect between what the family wants and what the patient wants. When we think nurse advocacy, being a patient advocate, but what is a nurse advocate? It's a registered nurse who acts as a voice for patients, ensuring their rights are respected and their needs are met. We work to empower patient. Now, all of us do, if you continue reading this definition. All of us in our practice do this, but there are actually job descriptions. There are actually positions that are nurse advocates, and the nurse advocates works in a healthcare system and just works to ensure that that patients' rights are respected. And when they're in this role, they also work, when we talk about policies and practices, in their employer venue, plus policies externally in federal and state and local government. They look to always try to improve healthcare policies and practice to ensure that the rights and needs of the patient and community is heard. How do they advocate? Well, number one, we ensure informed consent. We make sure that that people have the information they need before they make a decision. We respect their autonomy and ensure privacy and confidentiality. Promoting patient safety is advocacy, making sure that safety issues are addressed. And I would say nurses advocate for the profession by promoting nurse safety. In the past couple weeks, there have been some horrible situations in Florida. A nurse was attacked by a patient, and every bone in her face was fractured, and they are not sure if she survives, if she'll ever be able to see. That's how damaged her orbits were. And then in Pennsylvania, in central Pennsylvania, there was a case where someone just came in and started shooting in the hospital. And so I would say we also, a nurse advocate also advocates for the safety of nurses and nursing assistants in the profession. We address patient concerns. We look to support their emotional and psychological well-being. Which means we treat the person holistically, and we make sure that they get the resources that they need. And then always advocating for high-quality care and making sure that evidence-based practices are instituted where we work is another way that we and nurses who are advocates advocate. Now, how can we become a more effective nurse advocate? Well, initially, outside of the policy course, always making sure that you are the patient's champion, that you are, no matter if the physicians or the hospital is worried about the family and the family suing and all of those types of issues that often arise, always advocating for what the patient has requested. I was once told when I was advocating, because a patient, when I was working neuroscience at the time, patient had a brain tumor and had been fighting for several years she was very elderly. She didn't want surgery. And I had to fight because once she went into a coma because of the tumor, and her family brought her to the hospital. The family said that they wanted her tumor to be excised. And the patient knew that she was 90 now, and her quality of life would never be the same. And she just she had lived a full life and she wanted to die peacefully. But the hospital, when I was fighting, I was in a teaching hospital, and they wanted to operate because it gives a chance for the neurosurgery students to excise the tumor. I was told by the hospital administrator that dead people don't sue, and that he was going to allow this surgery to move forward even though the patient did not want it, because the family was now the decision maker and they wanted this surgery. And it wasn't long before I left that facility because I did not want to work somewhere like that. But in these days, particularly with everything going on in the world, and we need to make our voices known as nurses, because sometimes right now decisions are being made maybe because people think that they're doing the right thing because we have, fraud, waste, and abuse in our government, which, I can't argue that, but it's like we're just chopping. We're not looking and seeing what needs to be done. So we really need to have political engagement and activism amongst nurses, and work collaboratively with physicians and with other healthcare and even hospital systems. I think it's going to come down to soon. We're all going to be on the same side, because we need to advocate that healthcare in this country is not damaged by the desire to cut budgets. Yes, do we need to tighten the belt as a country? I'm sure that's true. But we need to make sure that the most marginalized and poorest among us don't suffer because of that. So political engagement and activism is more important than ever. And then the collaborative approaches to advocacy. This week, you're going to find just a case study that I want you to think through yourself. And then at the end of the week, I will post my answers to the case study so you can see. It's not an assignment you have to submit, but it's a thinking process. This is a short video and PowerPoint week. I put the readings or 3 articles I found that I want you to read that I have as PDFs in the weekly folder. And I want you to think about advocacy. And after you read through the articles and you think through the week's lesson, I want you, for your reflection, to write a strategic plan for yourself on how you can become a better nurse advocate, a better political advocate. And that's no matter what side you come down upon. Politically, there's always room for all of our voices to express what we need in this country and how we can advocate for nursing and for patient care. Right now, patient care is at the foremost in my mind, with potential cuts in things like Medicaid. I don't know exactly what the budget is because it's not clear, but cuts have to be made to departments. And I don't know how they can cut these areas without it impacting Medicaid and SNAP with the food stamps, etc. So this is what I want you to do this week. Next week is spring break. I'm just going to put it's not no assignments, just a midterm update. And I also want to remind you, I'm going to make an announcement that I wanted it last Sunday, but I haven't gotten it yet, and I'm not going to penalize anybody. But before spring break, so before, the end of this week, which I end on Sunday, not this Sunday, but next Sunday, I'd like you to tell me what you think your topic is going to be. And I do this not because you can't change or anything, because this class is often less intense than your other 2 classes. And if you don't start thinking about it early, you're going to be scrambling at the end of the semester. And there are a lot of points in that final paper and PowerPoint. So I ask you to think about it now for your own sanity, because I don't want you to have to scramble at the last minute. Have a great week.